And now that we're here today in person, I have a printed copy so that way I go over it with the patient, answer any questions that they might have. So during this step, I always tell the patient to kind of break the ice. I will tell them, do they have sleep apnea or not, and then what severity. When I review the report on page 2, on this page is when the physician, the sleep physician, gives their recommendation. You want to make sure you read this if you're actually reading the report, because sometimes they might recommend the oral appliance. They might start off with a CPAP machine, or they might say that they have central sleep apnea and then the appliance may not be effective. So you don't want to give them just a general information. This is where we review this and do our due diligence. Based on this report, it says that with changes in lifestyle as well as the sleep appliance, it addresses the sleep apnea of mild and moderate cases. On the actual report, I love this report because it actually shows a graph that gives us a AHI value. So this value, to oversimplify for patients so that they can actually visualize it, I tell them, you gave us about 7.5 hours of good quality sleep. Throughout that whole period, you had 20 events. The way I define 20 events would be either you stopped breathing throughout the night, or you had moments where you didn't get enough oxygen, and you had moments where you either woke up or there was interruptions to your sleep. Obviously, that's not how AHI is represented. There's other information like that true oxygen saturation, but that's a good way of thinking, you know, if they're sleeping 8 hours, they have 20 moments throughout the night where they're interrupted. I always tell patients the way sleep works is a cycle. On average, the cycle to get into REM is 1.5 hours. So if you have any interruption, that cycle resets. So that's why you have patients that give themselves 8 hours of opportunity to sleep, yet they feel tired, fatigued, because they never actually got to that 15-20 minutes of REM where they're actually getting the good rest that they need. Over here, to be brief, I usually talk about the oxygen saturation. I tell them that on average, you want to be as close to 100% as possible. Their average falls around 94, but they have events where it drops down to 81. Anytime your oxygen saturation is less than 90%, it's almost as if you're holding your breath for that extended period. And as you're aware, that's not really good for your health, so you kind of want to emphasize that to patients. On the second page, a lot of information, a lot of data. I always kind of focus on the sleep stages. I love printing out in color because it can highlight the good quality sleeps that they have. For this patient, we can tell them how long it takes for them to fall asleep, how long it takes for them to get into the REM, and how many times throughout the night there are interruptions where they have woken up, whether consciously or unconsciously. Last page, just some fun data, telling patient that they like to sleep on their back primarily, telling them how loud their snoring is so we can actually quantify it, and then just some more graphs. But at the end of the day, you just want to tell them how severe is their sleep apnea. Have identified to be moderate sleep apnea. Why is that important? Mild and moderate cases, these appliances work great. They're equivalent to the standard of choice for treating sleep apnea, and we find that they've had great success.
Great.
All right.
So let's take an impression, doctor.
Yeah. So for the impression, what you want to do is you want to scan the maxillomandibular. The machine that we use, the scanner, it shows us deficiencies in certain areas, so make sure you don't have any deficiencies. It's going to be a lot more customized than just a normal occlusal guard, so there's less room for error. The protrusion, like I said, you have these specialized device, these George gauges that you use to measure their maxillary protrusion amount. A lot of times in the past, people would just scan their bite and CO and then send it to the lab, and the lab guesses where their protrusion is. I try to avoid doing that because if patients, they sometimes have deviations when they move their jaw forward, so you want to capture that. You want to capture the midline, making sure that's centered. To Medit link, you want to type in the patient's information. So first and last name, their gender. For date of birth, I usually just go with date of scan. That way, if you have to do multiple scans, you can kind of trace it. So we'll do 2026, 04, 24. Man, April is almost over. Okay, so once you save the data, you can search up the patient. Then you go ahead and select new case. So test, we'll go ahead and go scan. Whenever you're using these scanners are really expensive. This itself is like $15,000. You always want to make sure you have the strap on so that there's no accidents. Once you have this on, sometimes when it opens up, it won't start because it needs to warm up. So we would have to just wait for it to warm up to begin. You always start with the top scan. Biggest thing is you want to capture all their teeth. Even if they have wisdom teeth, you need to capture a little bit of it because the appliance wraps around it, so it can have some interferences that you might not be aware of. One of the common mistakes that providers or assistants make when they're scanning is not understanding how these scanners work. What you want to do is you always want to start by scanning the occlusal plane. Once you scan the occlusal plane, you go ahead and wrap the scanner to the buccal and capture the buccal, then wrap yourself to a lingual. You don't want to do these motions where you're swiveling back and forth and moving around, because that's not how this specific scanner works. So the data might be corrupted or there might be poor overlap. Let me go ahead and do the scan, and I'll show you the areas that with AI technology shows the deficiencies that you have to catch. Okay.
And we do not want to let the AI fill the deficiencies, because then it's not going to be as good of a fit.
Yes.
Right, doctor? That's the main mistake a lot of people make, is they're allowing AI to fill the deficiencies.
Yes, so AI does wonderful things, but one of the things that it doesn't do is this guesswork. We don't want the technology to guess for you. You gotta make sure you collect the data yourself. If there's areas of deficiency that you scan over and over and it just does not compute, you can move forward, but you have to make aware in your notes that there's a deficiency there. So if it's not fitting, that's the first place you want to look at. Okay? All right, for the next step, I'm using something called a George gauge. It comes in two pieces. This part is disposable, this part is not disposable. There's a couple $100, please don't toss this. The way it works is this captures how much you can protrude and retrude, and that's where we want to find that nice middle ground. So first thing you want to do is make sure that this piece, which is adjustable, sits on the bottom of the teeth. So go ahead. So this seats nicely. If it does not, you can twist the bottom in order to adjust it left and right. So at the bottom piece here, you can adjust it. It moves this forward and backward. You want to make sure this sits all the way down. So when you have them seated, you want to make sure it fits right there. Reason why this is so important, because if it's elevated ever so slightly, that 1 millimeter, half millimeter increase in the bite causes like 5-10 times error in the back. So we want to make sure this is accurate. Next thing you want to do is, now that you know the bottom is good, now you want to have fit this. You're gonna position the bottom, have the patient slowly close, and you align it and guide it into this notch right here. So go ahead and open. So we put this in here, then we go ahead and find a nice spot. Go ahead and slowly close, and boom, perfect position. So as you can see, Dr. G has wonderful teeth. This is a perfect curve of Wilson and curve of Speed. So the appliance will work wonderfully for him. So now what you want to do is go ahead and close again. You're gonna hold this part right here and have the patient move their jaw forward as much as they can. There we go. And then all the way back. So we're training the muscles. All the way back. As you notice, if you do this multiple times, you'll notice you'll be able to go further and back and forward. Open all the way. So based on the measurement, go ahead and back. His maxillary distance of movement is about 13 millimeters. Forward as much as possible. So since you know it's 13, you're gonna bring it down to about 7. Go ahead and move Go ahead and turn to the left, Dr. G. As you can see, he's mostly edge to edge, maybe ever so slightly protruded a little bit more, maybe about half a milliliter further. What you're gonna have the patient do is have them continue biting, lock in that bite so you don't move. Then you tell them you're gonna go ahead and manipulate their lips and their cheek. You scan one side. You'll get the information and the results. Then you go ahead and scan this side. Make sure you try to scan both sides to get the best occlusion as possible. Then you have them hold it. You don't have them clench or bite down real hard. Just have them hold, and then for a couple minutes you find out, is it causing any jaw discomfort, any muscle soreness. If within these few minutes that they're wearing it causes pain, you gotta reassess that. Make sure that their midline is correct. Make sure there's no deviation. Making sure that it's not too protruded, because if it hurts within the last few minutes, that might be an indicator that there's something else going on. Now go ahead and close. So a lot of times, if this is your first time doing it, it's good to record the center or the middle part right there where he's starting. Now you want to support this, so when he clenches and bites and moves forward, you can measure it. So go ahead and move forward as much as possible. There you go, and all the way back. So that's like +9, -4. -5 now. Go ahead and move forward one more time. And then all the way back. So as you can see, the total distance is about 13, 14. So now move forward slowly. So now you want to move about 7. So there is 5 right there, and then a little bit more. 6. And a little bit more. There we go. Oops. You twist it, engage it, lock it in, and then this is the position that you want from it. What you do is
Is that centric relation or centric occlusion? Or is none of them?
It's none of those. So a lot of times, if you don't have these devices, edge to edge is typically a good starting point.
So is this edge to edge? Basically?
For your case, it's about edge to edge, correct?
So that's the measure you just got edge to edge.
But sometimes,
and that's how they're gonna make the device from the beginning. Right?
Exactly, yes. So they'll start it there. They'll give a little bit of leeway, so if you have to bring it back a little bit more, you can. But then that's a good starting point. That's that 50% that I was speaking of. And then as we follow up with them every month to month, I would adjust it half millimeter up, determine where they're comfortable. Once you titrate enough and it's consistently reliable, patient feels comfortable, patient doesn't have any changes or concern, then you want to finish it with an updated sleep study. That updated sleep study will show that our treatment was a success, and then you can go ahead and say, this is what you're going to be using. We follow up with them every 6 months, a year, just to see if there's any issues with the device. So here we have a deprogrammer. The whole purpose of the deprogrammer is to reset your bite, to bring the patient's bite back to that centric occlusion. A lot of times when they wear a device like this that is not their normal occlusion or alignment, when they wake up, sometimes the muscle forgets. So this is the job of this, is to reset that device. So when you open up, they'll give you instructions. If you're the type of person that likes to read, go ahead and read through it. But to simplify how this works, you want to make sure you have boiling water. Once the water is boiling, you place it in here, you grab the device. Before you insert it, you want to show the patient what you want them to do. Because once they mold it once, it's done. If the bite's off, you have to get a new one. We don't want to waste money. So a lot of times here, there's a notch. So that notch you want to put on the bottom. You want me to open this?
Sure.
Yeah. Okay.
Do you have the hot water in this?
Do you want me to actually make one?
Yeah, let's make
Do you have one, Dr. G?
I have one, but
Let's make you another one. Okay. So another mistake that providers make is they give the sleep appliance, but they don't give these deprogrammers. Why is that a mistake? It's because these deprogrammers, in the morning, it helps reset their jaw, reset their muscles. If we don't do that, then it changes the bite and causes a lot of problems in the future for patients. For this step, what we're going to do is we're going to go ahead and make sure that the patient understands how the bite's going to look. So go ahead and open. What I want them to do is I want them to go ahead and do their natural bite all the way down. Perfect. Now go ahead and open. So when you insert this, you want to make sure that this is on the bottom of their mandibular, and it kind of helps guide their position right there. And then go ahead and gently close, and you want to make sure that they are able to bite in that position. Go ahead and open. When you heat it up, it will become clear, and that's when you know that the device is ready for molding. You want to let the patient know to bite down all the way until their teeth touch. That'll be when you know they're ready. You're gonna have the patient bite for roughly about 5 minutes until the transparency goes away and it's a nice, the nice white appearance. So now it's clear, as you can see. Go ahead and position it. You insert it right here, and then go ahead and bite down until your teeth touch. All the way down, all the way down. And you ask them, does it feel like your teeth are touching? Good. So then you have them hold that. Roughly about 5 minutes. There's a good opportunity to step out and talk to another patient. And then once it's all done, you have this part.